San Diego's City Heights neighborhood is seeing a higher rate of coronavirus cases than the rest of the county. And it's the same story in Southeast San Diego. These communities that have higher rates of Black and Hispanic residents are where the nearly century-old and now illegal practice of redlining occurred. That's when a government-backed body marked maps of predominantly minority communities in red and labeled them a poor financial investment.
Black Americans being essentially by policy forced to stay in one part of a community, and white Americans being encouraged and supported in staying in another part of the community.
UC San Diego's Cheryl Anderson joined me outside the School of Public Health, where she's dean, to explain how this anti-Black policy led to the health disparities we're seeing today in Black and even Hispanic communities.
The start lines are different, and so you now have certain neighborhoods that by sheer structure and design don't get resources.
She says those disproportionate jumping off points became exacerbated over time.
And then you look up and you see outcomes, whether they be educational in nature or health in nature, and you say, oh, it must be that there's something wrong with Black people because Black people are having these poor outcomes. No, Black people were by policy forced into neighborhoods that were not developed, that were not invested in.
Give me a specific example of a lack of investment.
So you have a policy around housing that then settles people in a neighborhood where it is more likely to have tobacco and alcohol sold to you, where you are less likely to have green space and be physically active, where you are less likely to have access to grocery stores that allow you to nourish yourself in ways that are more adequate.
She says this goes back to zoning and planning decisions.
And then the chances of you developing high blood pressure, diabetes, lung disease are increased.
The center Anderson leads works with groups here in City Heights to provide better healthcare access. And it also established community gardens to provide healthier options for the area. But Anderson says that's just a small part of what needs to happen.
The real deal is when we take a justice approach, which is to really understand what is the barrier, what is the reason, what is the root cause for us seeing the outcomes that we're seeing, and removing those systemic barriers so that people can actually have, the ability to get to that better outcome.
I asked Anderson if there's anyone, anywhere, doing the work to counter these barriers. And she brought up the recent news that certain sports teams are rethinking their mascots that people have long pointed out are racist.
They're rethinking it because certain businesses are saying, we will not advertise, we will not support you if you continue to have this practice. And so I think what needs to happen is we need to think about this from a systems perspective. And we're all accountable. We all have a role here. And so when you see the power and the privilege beginning to listen and say, this is not okay, we have to figure out how it is that we're going to turn this around.
There might be some people out there, business owners or individuals, who have nothing to do with healthcare, who have nothing to do with providing resources for a community, who may think that they are exempt from having to take any action because they're not part of what created it and they're not part of the system that can directly fix it. But it sounds like with your mascots example, you're saying that's not the case.
If you are supporting a community practice that has racist historical origins, racism is not a deal breaker for you. So you may not be racist, you may not be practicing or engaging in a racist moment, but is racism a deal breaker for you? And if racism is a deal breaker for you, then the way you vote, where you spend your money, and how you exercise, your time and energy will somehow be engaged in trying to help us address this issue of racism.
Anderson is penning an op-ed on the actions an individual can take. Tarryn, Mento, KPBS News.